Well, welcome back to Spencer FYI. And if you've been following along, we've been doing this series on mental and behavioral health, and we've been mentioning the partnership with LINC. So maybe we should talk a little bit about what is LINC?
Fair question. LINC is Clay County Behavioral Health LINC, and it's LINC, and that stands for the Local Initiative for Networking and Collaboration. And really what that is LINC serves as the table or collectively a connection point for providers in the community to be able to connect and collaborate over resources and trying to provide the best care for the community. Our mission statement is having that wellness and community health through collaboration. So really that's what we focus on.
So how did this come about? How did that collaboration or that need for collaboration come about?
Yeah, so years ago, there was a study that was done that was funded by a family who had experienced loss, and they decided, what do we need to do better? And so the study in our community was done and identified a couple of different things, and one of them was the need for that collaboration with different partners, because oftentimes they have been operating in just their own little silos and not kind of talking back and forth. And so we felt like there was a need for somebody to help connect them together and to kind of be that conduit. And so that's how the Navigator position came about, and here I am.
Perfect. And I know one of the big things that you've done is worked on a website that kind of brings all of those resources together, right?
Yeah, so I did that in partnership with Care Connections of Northern Iowa. So they host that page. It's yourlink.org, and that was put together to be kind of that one-stop shop for our providers to submit information. So I do want to say that is providers submit the information, and then I get that added onto there. There's different blog content. There is also these interviews that we're doing with providers, so thankful for SMU Channel 3 and the partnership there for that, and just different things to help the community and our providers get to know what is out there. So if they are seeing a client or a patient and need to connect them with outside resources, they know who to call and where to go to. And likewise, somebody from the general public could get on as well. And if they're looking for something specific, they can kind of look up what's available in our area too.
And I know we've been kind of focusing on that mental behavioral health type thing. And why do you, I mean, other than the trauma of the flood and everything going on, but it's more than just that. It's an important thing for a lot of people to pay attention to. And I know that you kind of have some numbers and some reasons why it's important to kind of watch for your mental and behavioral health.
Yeah, so behavioral health is extremely important. I say behavioral health because that encompasses mental health, but it also encompasses substance use. And it's really important because a lot of the times the two interact together. And it's a fact. If you want some fun statistics, that 1 in 5 adults have a mental illness, and mental illness is as common as white cars. So if you're ever driving around the community, pay attention to how many white cars there are. And I just thought that was a really good representation or visualization of that, because it is common and it is okay. But I do want to also say that mental illness is not everybody has a mental illness, but everybody has mental health. So if there are days where your mental health feels challenged, we want to make sure that you have resources and that you have places to go that you can refer to help better your mental health. There's some numbers for Clay County that alcohol is the most misused substance in Iowa, and 113 people in Clay County were able to seek treatment. But for those 113, there's probably a lot that haven't. And maybe that's because of stigma, maybe that's because of they don't know where to go. And so between the providers and LINC, we really want to make that concerted effort for people to know where to go to seek help, because it's okay to do that, and we need to have those conversations.
Exactly. So like you said, we kind of focused on those mental and behavioral health providers, but there's also additional information that they can get as well, as far as like suicide prevention or Alcoholics Anonymous, stuff like that, correct?
Yeah, so on the page, if you kind of scroll down towards the bottom, there's some additional resources. There's a clergy list there, so if you would want to seek help or counsel with a faith-based community, that information is there for Clay County. There's suicide prevention resources, the Alcoholics Anonymous list if you'd like to attend a meeting or get involved with that. There's contacts there. There's kind of a myriad of different resources that are available. And then also then underneath that is the blog section, and that just has even more information, some video content and different things with some upcoming events, different educational resources and that. So the whole goal really is just to provide a collective area for people to become educated and get involved.
Alrighty. So besides, like I said, the website's a great place to go, but there's also lots of other additional resources that are available out there.
Yes. And I wanted to mention again, you mentioned it earlier, but I kind of jumped on it in my answer, but I just wanted to make sure that something that is important is there a list of hotlines and a list of national support organizations. So the list of hotlines, when you pull that up, that is going to have 988, Your Life Iowa, the Seasons Crisis Line, SAMHSA's Natural Disaster Distress Line. It's a lot of words. That's a good resource too, because they're specifically dealing with mental health concerns after natural disasters. So, be perfect for those in the community. SAMHSA is the Substance Abuse and Mental Health Administration. Just there's a lot of acronyms and things too, so I want to make sure that people know what that is. But you're welcome to pull that up. That has all of those things in there. We've got a lot of professionals in our community that are able and willing to help, and so we want to just again make sure that people can contact them and get the help they need when they're ready to do that.
Yep, they realize that you're not alone out there. There are folks out there to help.
There are, and different ways. I mentioned faith-based community is a great help. Peer supports are able to help, and those are people with lived experience that are going to walk alongside you. So the crisis line that you can call in and talk to folks. There's a lot of options out there. Your Life Iowa and 988 are great resources, and so we want to make sure that people are able to utilize those as needed.
And some of them even do text and stuff like
Yes.
that too. So you don't actually have to talk to anybody if you don't want to.
That is true. Yes, there are text and there are chat options as well for some of those, as well as their website with resources and things like that on there too. So hopefully something for everyone that will be helpful to them.
All right, awesome. I need to thank you for helping us kind of get this going and helping us with this series that we've done here. And I think that hopefully it's been good for people out there to know that, like you said, that there are those resources out there and there's lots of options.
I want to thank you so much for being a partner in this as well, because it's so important for that education to get out there, because you don't know what you don't know. And so the more that we can work to have the conversations on this topic and how to help, not only yourselves, but how can we help our neighbor? How can we help, our friends in the community? The stronger the people in the community, the stronger your community is going to be as a whole. So we all need to look out for one another, and this is hopefully a great way to help facilitate some of those things.
All right, awesome. Anything else? Anything else you want to mention that I didn't ask you about?
Yeah, I do want to mention that there's just a couple of different tips and tricks, I guess I would like to share with everyone. And as we have that conversation and we talk about making it okay and talking about mental health challenges and talk about substance use challenges and things like that, the main thing that I guess I would like for the community to know is to educate yourself. You need to kind of know that this is what might be going on, and this is how somebody might be feeling. This is how you might be feeling, and kind of, just become educated on what symptoms look like, how you can ask for help, where you can ask for help. And that can be done by going to the LINC website, talking to our professionals, listening to this video series. There's a lot of different avenues, but really become educated. There are also a lot of our providers do great outreach. And so you'll see from time to time advertised, we're going to do a suicide prevention training. We're going to do a opioid abuse training. There's lots of professionals that are using that expertise to educate the community. Please take advantage of that. It's most of the time they're absolutely free to attend. Just please take the opportunity to do that and be a part of the conversation. Really be a champion in your community. Stigma is a huge thing, unfortunately. And so to be able to start making those conversations more easy to have, really be a champion. So if you have lived experience, you know a little bit of that where you find that your knowledge would be helpful for somebody out in the community to potentially save a life, become a champion and talk about it. If your work has an EAP, talk about that. That I think that's a benefit that a lot of companies have, but maybe potentially is underutilized because people don't know, what to expect or what to do with it. If your company has the ability to host a Make It Okay training or a stigma training or something like that, again, most of those things are free. There's no cost, but becoming a champion and stepping up and asking for those things to help yourself and your coworkers and your community.
All right, awesome. And like you said, just reach out. That's probably the number one thing to do, and make sure you let people know if you're not feeling the way you feel like you should feel.
Yes, yeah, because our mental health changes every day, and it really is important for you to be able to, if you're having kind of an off day, are there some breathing exercises? Should I be meditating? Could I go exercise? A lot of those different things that some of our professionals have talked about, really actually doing those things. And I know it's hard, but trying to do those things and making a concerted effort is really, really helpful in helping yourself. And I guess I want to leave with saying we have a wealth of professionals in our community. Just make sure that you utilize them and their expertise. We have a lot of resources in Clay County, and so it's really important to use those and to utilize them.
Well, awesome. Thanks, Jill, for taking some time to talk to us here and helping us get things set up here.
Yeah, appreciate it, Karen. Thank you so much to you and to SMU Channel 3.
You're welcome. You're welcome. We'll be back with more right after this.